Hi, my name is Dr. Marty Willmitch. I'm a licensed chiropractor in the state of Florida. I'm also currently getting my diplomate in clinical neurology through the International Academy of Clinical Neurology. The reason I put this video together today was to basically give you an idea as to what ADD, ADHD really is and some of the treatment options that are available for your child these days. Before we talk about ADD and ADHD specifically, let me give you an idea as to how the human brain functions. Our brains are composed of two hemispheres. We have a right hemisphere and a left hemisphere. In a normal functioning person, both hemispheres are functioning equally. In children with ADD and ADHD, something causes a shift. The left hemisphere becomes very dominant, very strong, and consequently it suppresses the output of the right hemisphere. Now, in a normal functioning brain, the right hemisphere is what's responsible for stopping activities. It helps to stop movements, especially stop thoughts. It functions sort of like a brake pedal in our car. Whereas the left hemisphere functions more like a gas pedal. It helps to start movements, start activities, start thoughts. So in children where we see a very overstrengthened or dominant left hemisphere and a very weakened right hemisphere, it's very easy to understand why they act the way that they do. Basically, the right cortex, the right hemisphere, specifically the right prefrontal cortex, were the centers that house the ability to not be distractible, to not be impulsive, to be able to focus and concentrate on a particular task at hand. All those centers are housed in that right prefrontal cortex. And when its output gets dampened or squashed by a very dominant left hemisphere, you can understand why your child acts the way that they do. The good news is that these children are very fixable. These problems are fixable. They do not need to go on suffering with these problems indefinitely. You can functionally rehabilitate these children. The way you do that is just like exercising or rehabilitating a muscle. So I want you to think of, basically compare the brain to a muscle in your body. If you damage a muscle in your body, the way you fix it is to rehabilitate it. Basically what you do is you make the muscle move. Every time you move that muscle, it fires. The more that muscle fires, the stronger it's going to get. The stronger that muscle gets, the more normal its function is going to be. The same thing holds true with the brain. If you have a dampened or weakened aspect of the brain, you make it fire. The way you do that is by stimulating it using specific neurological pathways. The more you stimulate a weakened area of the brain, the stronger it's going to get. The stronger that area of the brain gets, the more normal its functional output is going to be. Just like with a muscle, once you've completely rehabilitated and built the strength back up into the muscle, it's fixed, it's done. You do not need to continue on doing those specific exercises. It's functioning normally. The same thing holds true with the brain of a child with ADD and ADHD. Once you've completely rehabilitated it, it's fixed. It's back to normal. There is no further need to continue with therapy. That's why I said these children with these particular problems are fixable. Not treatable and manageable, but fixable. You can fix these children. That's why I put this video together. I want to emphasize the fact that you as a parent have the ability to get your child fixed. This video is extremely brief. I just wanted to emphasize those facts for you today. What we've done is we put together a full-length DVD, an educational DVD free of charge. If you're interested in what I had to say today, I beg you to either call our office, the number's on the website, it's 813-933-6481, or you can register right there online, and we will happily send you a copy of the DVD explaining everything in very much detail in regards to ADD, ADHD, and some of the specific therapies that we use to treat and fix these children. So in closing, if you are a parent of a child with ADD, ADHD, or you happen to know a parent of a child with ADD, ADHD, take a look at what we have to offer, request the video, request the DVD, take a look at it, watch it a few times, understand what I'm talking about. There are definitely a lot of things that you can do for your child to get them back into a normal output, get them back functioning normally in school, get them back on the track to, a fruitful career. Thank you for watching. I hope it answers some questions. If you'd like to learn more, like I said, call the office or register online. We'll be happy to send you out an educational DVD. Thanks.